Welcome to the latest installment of Nurture KC News, a periodic podcast of Nurture KC, highlighting top issues of interest in the maternal and infant health space. My name is Tracy Russell, and I serve as the CEO of Nurture KC. And joining me today is Nurture KC's Kansas lobbyist, Sean Gatewood, and Nurture KC's Community Engagement Director, Ahkeya Howard. Welcome to both of you. Today, we're going to talk about what happened in the Missouri and Kansas legislative sessions, as well as some of the federal activities that are occurring as we speak. So why don't we start with the Kansas side? And both states really have similar legislative priorities, similar compositions in the state house. And one of the issues that we have been working on for the last couple of years, particularly on the Kansas side, has been around immunization and, in particular, protecting the childhood vaccine schedule. So we've had good luck with that for several years. This year marked a change. So, Sean, can you talk a little bit about what transpired at the end of the Kansas session within HB 2045?
Sure. So over the last few years, we've kind of seen an increasing opposition to vaccines. That it used to be a very small but vocal minority, and that has, particularly since the pandemic, seems to have really picked up some steam. And that is at the same time, quite frankly, we've lost a few of our key champions in the legislature. So we chairmen and vice chairs and leadership and whatever, that a lot of those folks that were very much in the mainstream of support of vaccines have left the legislature, lost elections, whatever it is, and have ended up cycling out. And we don't have those people in those key roles anymore, or at least not to the extent that we used to. This bill was a bill brought by the governor's office that established an office of early childhood. But as it pertains to the vaccines, it offered what is essentially a philosophical exemption, which was new ground. You can just say that I'm philosophically opposed to a vaccine and be exempted at the preschool level. This does not impact K through 12 education, but preschool. And so that's new ground. And I'm quite afraid that each time we lose one like this, where some may view that as something very small, again, the kids are going to have to be picked back up by the time they're in school, that this just further emboldens folks that are in that, like I say, rather vocal minority about vaccine policy.
Right. And I know that one of the arguments that we heard during that debate was, well, people can already very easily get a religious exemption, so this is not a big change. But I think in the context of what we're seeing at a federal level, we're in the midst of a measles outbreak here. At Nurture KC, we've seen a clawback in our federal immunization grant, that these things coming together all have potential great impact going forward around vaccine confidence by the general public, as well as just the ability of public health to educate and get that message out as kind of counter messaging to what we often see on social media. So from my perspective, any change you make, this year's ceiling in policy becomes next year's floor, and then that's what they work from. Would you agree, or do you think I'm being a little paranoid here?
No, I think that's exactly right. And from the federal level on down, we just keep seeing more and more sort of news that is questioning, but it's questioning in bad faith. And that every year you can see those immunization levels fall a little bit. And that has consequences, as we've seen, with the measles outbreak that is I don't remember, like 6, 7 states last I had looked, and spreading rapidly. So yeah, everything that, whether it be preschool kids or later, everything that sort of slowly erodes right now, all of that's picking up steam, particularly at the federal level. So this didn't help that, not for Kansas especially.
Well, and in terms of the maternal and infant health space, babies aren't eligible for many of these vaccines in those early months of life. And so we count on that herd immunity to protect them going forward. So that clearly has us very concerned. I know we could talk about immunizations all day. That could be its own podcast, and maybe it will be at some point. But let's move on to another issue that we worked on this year in Kansas, where we were able to be a little bit more proactive, and that's around paid family and medical leave. This is an issue that we came to in the last year or so, primarily around the basis of paid parental leave. We know that paid parental leave improves mental health for moms. It allows for the parent and child to bond during those early, critically important first days, and really gets that child off on a developmental trajectory that we want to see. And the evidence backs that up. We have 14 states in the country that have a paid parental and family medical leave law. We have many states now, in fact, a majority, that actually offer paid parental leave for state government employees. So, Sean, can you talk a little bit around our activity around that this year through the Paid Leave for All Kansans Coalition and our strategy going forward?
Yeah, so this is one, I'll be honest, the vaccine thing, very, very motivated by that. I love it. My wife's a pharmacist. I'm a former paramedic. We have those kinds of things in our that makes us sort of dedicated on the vaccine front. But this one is something that just excites me. I feel like it has the potential to really move Kansas forward, to Kansas families in specific. So what we've done so far is we've met with members of leadership in the legislature and individual legislators, and we've really gotten a lot of very positive feedback. Now, that isn't to say that something's going to just sail, but I didn't get nearly the pushback that I probably anticipated on it. So we're going to continue that. We're going to continue we're meeting with some legislators after we record this podcast today. And we're going to keep that stuff going. This is something I think Democrats like because of the ability to take care of kids and your ailing parents, your own illness, that sort of thing. And you kind of have a social safety net built in. But a lot of the conservatives like it too. And I think that's the part that I think surprises folks, because what we're putting forward is a pretty conservative solution. It takes no tax money, very little input from the state to govern the program. And really at the core of conservative thought puts the individual family at the center of society. And I don't think that there's many policies that do a better job of that than this. You know, your family gets sick, you need to be able to go take care of them. When you have a kid or your own illness, to be able to take off of work and still make a living and not fall onto social dependency, on dependence on the system is a very, very big deal. And again, this is all private money. This is contributions by the employees and employers and not paid for by the state. So at the core of it is a conservative solution to a problem that I think that we can all probably very much agree to. Anyhow, that's kind of where we're at right now as far as what the proposal is and what we've been doing.
Well, and I think the reason why it enjoys kind of bipartisan receptivity to it is this is universal. Every person at some point in life is going to be affected. Either they become a parent, they experience their own serious illness, they're trying to take care of perhaps aging parents. And it's time that we recognize that Kansans are not just workers. They are people too. And we need to meet them where they're at and put programs in place like this one that will greatly impact their lives. And I would make the case that this is quite business friendly. Many small businesses aren't able to offer this type of benefit right now because it's not cost effective. Whereas if you have a statewide pool, those small businesses will then have this benefit for their employees as well. So I'm really looking forward to continuing to work on what I think could be an incredibly impactful issue for all Kansans. So let's switch a little bit and talk about kind of these federal and state relationships, because I feel like there's never been more of a link than there is right now. Just when you look at the Medicaid issue alone, And of course, Kansas remains one of the 10 states that has not expanded Medicaid to this point. But we did have some policies go through, one of which ultimately failed, the other did not, that I wanted to talk about a little bit. And if you could explain kind of the crux of the policy and what happened, that would be really helpful. So the first is there was an attempt to discontinue 12-month continuous eligibility within Medicaid. That ultimately was not successful. The second issue I'm going to talk about, however, was, and what that one does is it essentially puts any kind of service changes within Medicaid back in the hands of the legislature, taking it away from the department that oversees Medicaid. So can you talk through what you think the consequences of both of these issues will be?
Well, thankfully, not much in the way of consequences so far, obviously because it failed on the 12-month continuous eligibility. That would have been, and what was sort of decided in the legislature was that, as they say, the juice wasn't worth the squeeze. When it was legislators kind of looking for money, they felt like they might be able to get, frankly, to escort a few folks off of Medicaid and not have to pay for them anymore by having sort of a continual renewal process, as opposed to a program that once you're on for that year, that continuous eligibility. And, from a health perspective, that could have been pretty devastating just because that churn of coming on and off being insured or going from this insurer to that insurer or whatever that may be can have some pretty significant impacts for people just because you have continuity of care issues, who's in the network, who's this or that. And then that folks are going to end up failing to get that stuff done. And I think we as Kansans want people to be insured so that they're getting their immunizations and they're getting their well checks, and particularly with kids. So that from the health side, I think that would have been particularly devastating, but really from the state side as well, because if you can remember back just a few years ago, there was a massive backlog of eligibility in the Medicaid program. So if you take away this continuous eligibility, you make people sort of reapplying constantly. That was my fear, is the burden on the state would become so great again that we would have those backlogs and have people struggling to stay insured. So I'm very thankful that didn't pass, and we should, folks should kind of let legislators know that was a good idea to not do that. That would have been a disaster. As far as what they call the LCC, the Legislative Coordinating Council, which is the committee when the legislature is out that they will now have to notify and get permission from to make any changes to the Medicaid program. That is some complicated policy. And I am not sure, if you're not a state bureaucrat working on the Medicaid program, I don't know that folks really understand how often those changes are filed, because it's a federal and state partnership. So there are constantly changes made to the Medicaid program that are relatively minor, that it is unclear at this point if those have to go through the legislative process, or at least the LCC, and what monetary level or policy level has to do that. It's really not all that certain. And there are a lot of those changes. And sometimes it really can serve to prevent real progress. And I don't want to use this as an example that this is not going to be, because this is something that I'm working on currently. I represent Kansas EMS. And so we're working on a program right now for community paramedicine. So that is something that, Democrats and Republicans of all stripes kind of agree on. But it's going to have to go through that process. So we're not real sure, because they see that as a cost savings, but it's a new program. So does it have to go there? There's just 1,000 ways to be confused by it. And if they all have to go through there again, the LCC only meets, I think, quarterly. Maybe it's monthly. I apologize. I should have done that research. Anyway, it holds up the process. And quite frankly, these things were intended to be executive branch bureaucratic decisions and not being taken to the legislative branch for every little thing. I mean, allocate the money, approve the program, a larger program, and then you let the folks that do the work on a day-to-day basis make those small managerial decisions. And so I'm not sure how that's going to pan out in the end, but I feel like that is sort of an erosion away from what should have been an executive function.
Well, and it certainly adds a layer of complexity to an already extremely complex program.
That's a great point as well.
Okay. Well, we're going to wrap up on the Kansas side. Thanks for everything. And we're going to turn to Ahkeya and talk about Missouri a little bit here. So it's been interesting over the last few years, even though there has been a Republican supermajority in Missouri, there has been a lot of infighting within the state house that has prevented much policy from getting adopted. We saw that change this year. And with that came some big revisions in policy that we're going to talk about in a few minutes. And we had a couple of priorities that did end up getting adopted this year that I wanted to touch on just briefly. The first of which is a bill that had strong bipartisan support over the last couple of years, and it's generally been coined the Women's Health Bill. But what the bill does is it allows for extended birth control coverage without having to go in on a monthly basis to get that for our women. And then it also provides for new testing for syphilis and other STDs during the pregnancy period, because we know if we can detect those at that time, they're quite treatable and that baby isn't going to suffer any ill effects from that. So we think that is a huge step forward in Missouri for both our moms and our babies. In addition, we saw the legislature adopt a sales tax exemption for diapers and feminine hygiene products, which we think is a great benefit for our families. And more than that, I think it recognizes that there are so many factors and expenses and barriers that our most vulnerable in particular face. And this is a nod in that direction that we were pleased to see. So, Ahkeya, as our community engagement director, you lead our community consortium, which is volunteers and advocates from the Kansas City area who have come together around different policy priorities that they want to focus on. And for this year, you have adopted housing as a policy priority, recognizing that particularly for the population that we serve, housing is one of the biggest barriers that they face. So can you talk a little bit about what happened on the housing front this year? And there are two issues in particular that I'd like you to address. One being the preemption of a Kansas City ordinance that would have prohibited source of income discrimination for rentals. And can you explain what that ordinance did and what this nullification by the Missouri legislature will do for that policy?
Yes, so Kansas City has always been a leader in recognizing that we must address broad systemic issues such as barriers to Kansas Cityans. Lack of accessible housing and affordable housing is certainly at the top of that list. So from Nurture KC's perspective, our families often struggle with housing, affordability, and accessibility, and rents have skyrocketed over the last few years. So the families we serve are often led by single parents earning with limited resources. These families qualify for assistance in programs such as Section 8. And so what this does is it recognizes that those types of incomes shouldn't matter in finding housing. And so in 2024, Kansas City recognized this and passed the ordinance to prohibit the discrimination against tenants who utilize vouchers and other assistance programs. But however, in the 2025 legislative session, the legislators passed a law that landlords rejected source of income like Section 8, preempting the city's ability to respond to the needs of residents and limiting accessible and affordable housing for Kansas Cityans.
Yeah, and I think we will continue to see the fallout of this. And to your point, rents have skyrocketed at a time when incomes have not kept pace. And just when we look at the families that we serve, one of the potential effects of this is that mothers may stay in an abusive home just due to the income constrictions of having a place to live. And we've certainly seen that within our own program, and it's not unique to us. So there are a lot of ills that can come out of this type of policy. And I will tell you, in my previous life, I lobbied for city governments. And so just that overriding of home rule authority and local control is troubling to me. I think we need to respect local governments and their ability to serve their citizens in the most appropriate way. So let's move on to another issue, and this one also passed. It was, I would characterize it as a controversial law that shifts the cost of utility upgrades to consumers prospectively. Can you explain this change and its potential impact?
Yes, that was Senate Bill 4, and it's a utility reform bill aimed at modernizing Missouri's energy infrastructure. However, it allows utility companies to raise rates based on projected future costs. So that means Missourians can be required to pay for power plants before they're even built or operational. This shift in billing based on estimated future costs rather than actual expenses weakens consumer protections and risks overcharges if projections are inaccurate. Estimates suggest that Senate Bill 4 could increase average household utility bills by as much as $1,100 per year. And this is in addition to the normal rate increases that we typically experience. These costs will hit low-income families, seniors, households with children the hardest, potentially deepening energy insecurity, where families must choose between keeping the lights on and meeting other basic needs like food or medicine. This financial strain could also contribute to increased rates of homelessness. And as you stated before, despite these concerns, Senate Bill 4 was still passed into law.
Well, and again, this becomes a little bit like death by a thousand cuts. It's like here you've got more on the expense side with the increasing cost of housing, but yet you can't use the sources that you have available in income to even get a place. So, this continues to make it very difficult on Missourians as they try to rein in their own costs and live within the budgets that they've established. Thanks, Ahkeya, for all of your work and to the consortium. And I know that your group was very active and vocal during the legislative session on these issues. And I know that it will make a difference going forward as we continue to spotlight the critical issue of housing in Missouri. Okay, so there are a couple of issues that I wanted to talk about that really took up a lot of time and energy in the State House this year, and both were decided in the waning hours of the legislative session. And those pertain to two amendments that were passed by voters last November in the general election. The legislature is seeking to undo both of those initiatives right now. The first was a bill that established Missouri's minimum wage at $15, but it also included an annual adjustment to that so that $15 wouldn't be a freeze essentially on the minimum wage. What it also did for the first time was it would require that Missouri workers would be entitled to paid sick time, something that a good number do not currently enjoy. So this was passed by the voters, but it was a law change. It was not a constitutional amendment. Consequently, the legislature could come in and vote to just undo the law. And that's precisely what they did. And keep in mind, this is a policy that passed with 57% of voter approval, which in today's polarized environment is quite overwhelming. That's an overwhelming majority in the state of Missouri. And so what the legislature has done is they maintained the $15 per hour minimum wage with no escalation going forward. And they did away with the paid time off entirely. So, and keep in mind, that paid time off was already accruing for Missouri workers by the time they pulled it back. So it'll be interesting to see what the next steps are, if supporters of this try again, or if there's any fallout from these actions, but that's where it stands right now. The other issue, which garners all the headlines, is last November, Missourians also passed a constitutional amendment protecting the right to an abortion in the state. That one passed, I believe, with a 52% majority. That was a proposed constitutional amendment, so Missouri's state constitution is now amended. Lawmakers are attempting to repeal that, and they voted to do so, but because that was a constitutional amendment, that goes back to a vote of the people. So we'll see that on the ballot in 2026. And again, aside from your feelings on the merits of the policies, it is the legislature basically repealing what the citizens have said they wanted. So it'll be really fascinating to see how this all plays out in the long run with the voters. Okay, so that kind of concludes what happened at the state level. I wanted to talk just briefly around some of the federal activities, and we are impacted by that, particularly right now. So at Nurture KC, we have the Healthy Start program. This is a program that was begun during the George W. Bush administration with the goal of reducing infant mortality across the country, which we've seen skyrocket over the decades, particularly for a developed country like ours. And Nurture KC has had that grant for over 25 years now. And there are 115 Healthy Start sites across the country. And I think the efficacy of this program is quite clear when you look at the outcomes. We looked at our data with Healthy Start, and what we have seen is we have a lower incidence of premature births for mothers in our program. Our mothers are also much more likely to get that early prenatal care that we know is so important both for their health and the health of that baby. So currently, there is an attempt to eliminate this program. And I think you have to view this in the context of everything that's going on in terms of, we're seeing reductions in Medicaid. We are seeing other efforts that eliminate many of the social supports that community organizations like ours provide. And you have a number of states now where there isn't reproductive choice. So families are having these children, and it's very important that we have the supports in place to help take care of those children. So we are working to maintain that funding. Nurture KC actually coordinated a day on the Hill to that end, and working with our respective congressional delegations in both Kansas and Missouri. And I'm hopeful that as a country, we will continue to prioritize these families and give every baby a healthy start. And so I would just end with, if you are so inclined, please jump into the fray when it comes to public policy. Lives depend on it. And we will continue to advocate on behalf of mothers and babies in Kansas City. Thanks for joining us, and stay tuned for our next episode where we will focus on infant safe sleep.